that is not the purpose of a birth plan. There's a lot of misconception about that. Like, why make a birth plan if you can't plan how it's going to go? So it's not saying this is exactly how the birth is going to go. It's just saying these are my preferences. Hi guys, it's Amanda with Eat Pray Crunch, and today I wanted to go over my birth plan with you guys. I don't think I did this in my last pregnancy, but I feel like it's something that I find really interesting when I'm watching other people's videos, is what people put in their birth plans, like what their preferences are and why. You know, watching people's birth plans and then seeing like how people's births go in reality, and just knowing my own experience from my previous 2 births, how my birth plan was versus how it went in reality. It's just been very educational to me, and I feel like it has opened my mind a fair amount, especially since when I was a first-time mom, and you have all of these ideas, this is how it's going to go, this, and you know, everybody always tells you you can't plan for birth. You just can't plan for every little thing that's going to come up, which is true, but at the same time, like, I've also learned that there's like a happy medium. Having gone through this twice before and knowing that yes, obviously you can't plan for every little thing, but that is not the purpose of a birth plan. I think there's a lot of misconception about that. Like, why make a birth plan if, you know, you can't plan how it's going to go? The point of a birth plan is to express your wishes to your health practitioner, be it your midwife or your OB or whoever, just so they know like what your preferences are. And I always like to frame my birth plan with plan A, plan B, plan C of sorts. This is my first choice, this is my second choice. Like, if we need to do this, then I would prefer to do this. So it's not per se saying this is exactly how the birth is going to go. It's just saying these are my preferences. And I think that that is really important, just because there are so many things that go into birth and during birth and after birth, decisions that you have to make, and it's really important to know what you want ahead of time. You know, there are a lot of first-time moms who go into it not realizing how much you have to educate yourself before you're in it, just because there are so many things that you don't even realize that you need to know. So that being said, that is why I do a birth plan, especially since I'm in the hospital this time. Now, I am with midwives, and my philosophy is pretty much exactly aligned with the midwives' birthing philosophy, so I'm not too worried about it, but it is within a hospital context. I mentioned in my last pregnancy update that I discussed some of those things with the midwife at my last appointment, and actually gave me a lot of peace of mind that the hospital that I'm going to actually practices hospital-wide, both midwives and OBs, a lot of the more natural practices that I prefer. So that gave me a lot of peace of mind as well, that I'm not going to really have to like fight to advocate for those things because that's just what they do anyway. So that's why I do a birth plan. So basically what I want to do is I have my birth plan here, and I just want to read through it with you guys. I'll maybe show it to you as well, just kind of give you guys an idea of how I laid it out, just kind of point out the things that are important to me and the wishes that I have for my birth. So let's go through it. So I just folded down the top here just because I don't put my last name on YouTube. I'll just show you guys here what it looks like. Just to kind of show you guys what the document looks like and how I have laid it out so that it's clear and easy to read. So that's what it looks like, and it's basically just bullet points, trying to do things by very clear categories so it's easy to read. I have each category in bold, so for example, if a nurse or the midwife is looking at it saying, oh, well, what are her preferences for cervical checks? Oh, well, look, it's highlighted here, it's easy to find. You know, like, oh, what's her preference for if she needs to go the C-section route? Like, oh, look, here's her preferences for C-section. I feel like I've improved since I originally did this the first time around, which we actually used my original birth plan for my son as the template for this, but just kind of adapted it to more of a hospital setting. Anyway, I'm just going to read it to you guys and just throw out any comments that might be insightful. So first of all, my birth team. I have mentioned this in some of my updates before. Obviously, my husband will be there. He's my number one. and my mom will be there. She was there for my other two kids during their births as well. She and I are very close, and she is a very important, special part of my birth team as well, and I think it's just so special for her to be able to witness the birth of her grandchildren. So she will be there. And then, like I mentioned in my last pregnancy update, one of my very good friends, her name is Erin, she is going to be my doula, since she is going through the training to become a certified doula, and she is working on getting births under her belt and that kind of thing. So that is my official team this time. First stage of labor. Amanda is not to be separated from Bill unless she requests it. Clothing, I'm going to bring my own birthing gown, the one that I wore when I gave birth to Sophie last time, because the hospital gowns, come on, like, they're really unattractive. Like, not that I need to look super glamorous or anything, but I do happen to have a birthing gown from when I gave birth before that is much softer, much more comfortable. It's designed for birth. You get all the access you need and everything very easily, and it's just like a solid color instead of the like ridiculous linen floral hospital gown that you normally get, you know what I'm saying. Atmosphere. As relaxed as possible with lights low and calm music. Minimize the number of medical personnel coming and going from the room. Maybe it's because I'm an introvert that I need things to be calm and relaxed, because that is how I focus on things. That is how I relax. And as we know, it's so important to be relaxed when you're giving birth, because that is what allows things to progress. If maybe you're an extrovert, you need that stimulation to keep you going and keep you motivated and energized. Or maybe like fast, motivating kind of music. I just need calm. That's the kind of environment I need. So that's why I have that in my birth plan. IV. Before epidural, I am asking for a hep lock so that I have the freedom to move around. So a hep lock, I believe, my doula was telling me about this, is when they just put the needle in your arm, but you're not attached to anything. You don't have to carry your little fluid bag around with you. As long as you're going unmedicated for however long, it allows you to move around, which is nice, but they still have access to your vein if they need it. So that is what I want. I don't want to be attached to anything until I get the epidural. And then vaginal cervical exams, I am asking to keep those minimal, just because it can introduce infection if you're doing it frequently. That said, some midwives are just not fans of doing any checks at all. Some people feel like they don't want to know because they might get discouraged if you're not as far as you think you are, if you've been going for a while, you know. But for me, having the knowledge of how far I am just helps me mentally prepare. Fetal heart rate monitoring intermittently or with wireless only unless otherwise medically necessary. So this is, you know, before the epidural. Research has shown that you don't have to have continuous fetal monitoring. Just doing a Doppler every half hour to hour is plenty sufficient. So that is what I am requesting this time around. That's what the midwives do anyway. Food and drink. Ensure that Amanda remains hydrated and has adequate electrolytes, and small amounts of food is desired. This is something I need to ask the midwife about, because I know oftentimes hospital policy, which is a little ridiculous, is that you can't eat anything because they're afraid that if they have to put you into an emergency C-section and you have food in your stomach and you vomit and you can aspirate it, that is why they tell you you can't eat. But honestly, let's be real, guys, this is like running a marathon and your body needs fuel. So I think it's a little ridiculous that you can't eat. I feel like there are ways to deal with it if you vomit, you know what I'm saying? I'm putting that in my birth plan. I don't know what the hospital policy is, but that is my preference, and I just want them to know that is my preference, that I would like to be able to eat if I am hungry, and to be able to sip fluids as well. You should at least be able to drink water. Yes, you can vomit up water, but I feel like it's a little ridiculous that women can't drink water when they're in labor. Like running a marathon. So I am just letting them know that is my preference. So pain management before epidural. Allow Amanda to move around and be in whichever position she desires. Use tub, shower, heat, massage, hip squeeze, deep breathing, and also the TENS unit. This is actually something that my physical therapist gave me for my neck and shoulder pain. If you guys don't know what a TENS unit is, it's basically these wires that you can connect, and it creates a very mild electrical current through your body. It can relieve pain. I have tried that, you know, for other purposes in my back and my shoulders and neck, and it does help relieve pain. And I have read a number of various midwife practices that actually have these on hand to help relieve labor pain, and you put them like on your sacrum, on your low back, and it can really help you manage the pain of your contractions. So I want that to be one of my tools. I'm going to bring it with me in my hospital bag. And then epidural. I already explained all of my reasoning behind wanting the epidural option this time. What I put specifically in my birth plan about the epidural is Amanda would like an epidural, but not before 5 to 6 centimeters, because research has shown if you get an epidural, especially before 5 centimeters, it can really stall labor, and I don't want that to happen. I want my body to continue its momentum. So that's why I want to do all of my natural methods up until 5 or 6 centimeters. And then Amanda would like the lowest dose possible. I put that in bold. Lowest dose possible, only as to take the edge off transition. She would like to be able to feel when she needs to push, so pushing is more effective. So like I said, like the main reason I want an epidural is to get through that transition, man. It is hard. And I feel like if they give me the option to just have a very low dose of epidural just to take the edge off, I feel like that is perfect. That is what I want. I don't want to be like completely and utterly numb where I can't feel a darn thing at all. I still want to be able to feel, especially when I have the urge to push. So I wanted to put that in my plan so the anesthesiologist knows that, not to just crank it all the way up from the get-go, but to just start with the lowest level possible. So I have that in my birth plan as well. Interventions. With the exception of an epidural after 5 to 6 centimeters, Amanda would like no other interventions unless medically necessary, after a thorough explanation and with consent. And then I have another section down below. See in case of complications for more detail. So I'll get to that section. But basically I am just letting them know that my view of birth is, like I said, it's a natural physiological process. I trust that my body knows what it's doing and it can get a baby out. It's done it before, I know it can do it again. And I really want to have very clear, informed consent. I feel like I am very educated about all of the medical procedures that are often done during birth, and I feel like I have a pretty good concept of knowing which ones are truly necessary and which ones aren't. If there are any of them that they are pushing on me that I don't feel are absolutely necessary at that time, I want to advocate for myself and just let them know, like, I don't want any interventions unless this is like legit medically necessary, not because the doctor wants to get home in time for the end of his shift. But being that I am getting my care from the nurse midwives, that is their philosophy anyway, so I shouldn't have to fight too much for that, thankfully. And then moving on to the next section, which is transition. Since I am hoping I will have an epidural by transition, this is in that case. So for movement position, Amanda's preference within the limits of a low-dose epidural. So I was talking with my midwife about this, and she says that she has had patients in the past who have had really low-dose epidural. You know, it's not a quote-unquote walking epidural, like you can't literally walk, but she's had people get on their hands and knees on the bed and, like, you know, move from one side to the other, change positions a little bit that way. I definitely want them to know that that is my preference. I would like to at least have a little bit of movement if I am capable of doing so with a low-dose epidural. Another main thing that I wanted them to know while I'm in transition is check for cervical lip before pushing, as to prevent inflaming the cervix and prolonging labor. This is one of the things that happened in my first labor that probably added at least 10 to 15 hours to my labor unnecessarily. My midwife at the time, she checked me and she said that I was at a 10 and that I could go ahead and push. She did not catch that I still had a cervical lip, and I was pushing against a cervical lip, meaning there's just like one little side of it that wasn't fully dilated. It was almost there, but when you do that, it inflames it and it makes the whole thing swell up, and you can imagine the kind of pain that causes and how much time and prolonged agony that adds to your labor. So just because I had a bit of a traumatizing experience with that, I just want the medical personnel to know, like, I had this experience, please make sure there's no lip before I push. I have that in my transition section. Second stage labor, I have food and drink, ensure that I am especially just remaining hydrated. Now, given that I'm going to be on an epidural, they probably will hydrate me with IV fluids, and I'm okay with that route as well, but I'm hoping they'll still let me take sips of water or electrolyte water as well. I just want them to know that's my preference. So during pushing, that's second stage labor. Support from birth team. Amanda would like the freedom to change positions in the bed, epidural permitting, like I said. Massage if desired. Warm compress oil on the perineum to prevent tearing if I feel that's necessary. That's just another midwife practice that they probably do anyway because it's their midwives. And that is actually also another reason I don't want a full-blown epidural, is because I want to be able to feel when I need to push rather than pushing so hard and not knowing when to stop also, because that can lead to tearing. And then I have the delivery section. These are the things that I want done with baby the moment of birth. So first of all, no forceps or vacuum extractor unless absolutely medically necessary. I'm really doubting that my labor would stall so much that they would need to do something like that this time. I recognize that sometimes it is absolutely medically necessary because baby is stuck or whatever, but I am just putting that out there, like, don't do it just to speed up labor, like, just let my body do its thing. Don't try to pull the baby out. I want my husband to catch the baby. I also have do not suction the baby unless the baby is having difficulty breathing. Humans have been giving birth for thousands of years without suctioning, and baby's lungs are just fine. Part of the physiological process of a vaginal birth especially is the compression of going through the birth canal, compresses all of that fluid out of their lungs. And so there really is not a legit need to do that suctioning right as they come out, because that can actually kind of be traumatizing for the baby. Now, granted, there are some cases where the baby's having trouble breathing and that might help them, but in most cases it's not necessary. Delayed cord clamping, so do not clamp and cut the cord until it stops pulsing. Thankfully, this is one of those things that is hospital-wide policy now, which is awesome, so they're going to do that anyway. So the reason for delaying cord clamping is, you know, a lot of hospitals just snip it immediately after the baby comes out, but there is legit reason, like well-studied reason, for letting it continue to pulse until it naturally stops, because it is getting all of the rest of the blood from the placenta into the baby, and it can prevent a lot of anemia. It can help reduce jaundice, that kind of thing. It can help babies' blood sugars remain up. All of these things that often hospitals later have to do interventions for with the baby that are totally preventable by just letting all of that blood from the placenta flow into the baby. That is the reasoning behind that. And then I have my section here in case of complications. Breaking water. I don't want them to break my water unless the midwife deems it necessary. This was an intervention that I had in both of my previous births, and I'm kind of feeling this time like I just want to experience my water breaking naturally. Granted, I understand that sometimes it's necessary if you are stalling. Like, I had preeclampsia last time. They really needed to get things going. And my labor was so long the first time that they were just trying to get things going. But if possible, I would like to just try experiencing my water breaking naturally this time. That's my view on that. If labor stalls, remove all sources of stress and tension for Amanda from the room. No Pitocin unless I am completely exhausted. So I'm doubting that this will be too much of a problem this time because it's my third baby and the last one went so fast. But you never know. You never know what's going to happen. One of the main reasons you can stall is because you are stressed. You have cortisol, the cortisol hormone running through your body, and that sends the fight or flight mode into your body, and that makes you clench. And that's telling your body now is not the right time. So relaxing, removing all sources of stress, that is my first go-to choice if labor stalls, to just really try and get in that relaxed state of mind. And then if that doesn't work after an hour or two or whatever, then go to Pitocin. Likewise, induction, no induction methods to be used unless medically necessary, like if I develop preeclampsia this time. Knock on wood, this time I am not showing any signs. I am in the last month of pregnancy now, and so far so good. I am not showing any signs, so hopefully it won't even be a problem. But if I do develop preeclampsia, that would be a legit reason to be induced. Sometimes there are other legit reasons as well, but I don't want to have any Pitocin unless it is absolutely necessary. And then I also have, if I do go on Pitocin, start on the lowest possible dose and gradually increase only if the lowest dose doesn't work. So that is my preference for that. If I have to have a C-section, from what I understand, C-sections are truly, legitimately medically necessary about 5% of the time. And the current rate nationwide in the United States is 30%. Like 1 in 3 babies born now is C-section, and that is not medically necessary. Granted, there are cases where it is legitimately medically necessary, and if I have one of those reasons, I am all okay with it. I am okay with getting a C-section, but I have some preferences for that as well that I put in here. Now, I don't know if the hospital I go to does this. I need to ask my midwife, but I am preferring a gentle C-section. And if you guys haven't heard what that is, that's actually a practice that some hospitals are starting to do now, which is much more mother-centered and baby-centered as well. It's trying to provide a lot of the same kind of birth and bonding experience that you get from a vaginal birth with a C-section. So these are my desires for that for my C-section, if I legit have to get one. So number 1, get informed consent, which is by law, you have to have informed consent, and briefly explain why, even in an emergency, I want to pray about it, even if it's briefly. I want to feel in my heart like this is necessary, and I want to not be bullied into it. I want to feel like, yes, you have my blessing to do this C-section. So informed consent, I need to know why, and that it is a legitimate reason. Number 2, my birth team to accompany me into the OR, but if only 2 people are permitted, just my husband and my mom. I prefer, obviously, local anesthesia unless for whatever reason those don't work. I've had friends that's happened to, like where the epidural just didn't work and they could feel everything. I mean, they obviously figured this out before doing the C-section, and then they have to do general anesthesia. That would be like the only reason I could imagine having to do general anesthesia, unless it's like so urgent, you know, that if the baby doesn't get out in seconds, the baby will die kind of situation, which is rare. But just saying, I prefer local anesthesia over general. Number 4 is, this is an interesting practice that I've been reading about recently that has really benefited C-section babies, and that is when a baby is born vaginally, they actually have their very first introduction to microbes and bacteria in the vaginal canal, and that is actually really, really important for jump-starting their immune system going through that space. And when a baby is born in a sterile C-section environment, they don't get that. The practice that they've been doing some research on is actually when they put like a wad of gauze in vaginally, basically, while they're giving you a C-section, and then they wipe the baby down with it after they come out, so that it's simulating that immune initiation, so to speak. And there have been a lot of positive outcomes with babies who have that done in terms of babies' immunity and health later on. So I have that in my birth plan as well, that I would like to have that done. And then, like I said, I put on here gentle C-section practices desired. Now, I don't know if they do this or not, but I'm just saying if you can make it possible, that would be great. So basically, gentle C-section practices are a smaller incision, and if possible, allow baby to push himself through the incision gently, which imitates going through the birth canal, so that there's a little bit of compression of the lungs to compress some of that fluid out. And then placing baby on mother's chest immediately instead of whisking them off to be cleaned off and, you know, doing all those things, and allowing baby to be on mom's chest while they finish the procedure and sew you up and that kind of thing. And then same delayed cord clamping, waiting until the cord stops pulsing before clamping and cutting it, just like you would do in a regular birth. And then I have preferred double-layered suturing, which prevents uterine rupture in the future. This will probably be my last baby, so doing VBAC in the future is pretty unlikely, but still, I don't want any uterine rupture happening down the road, you know what I'm saying? It's probably what they do anyway, but I thought I'd put it in there. And then baby to stay on my chest for skin to skin for the remainder of the procedure, like I said, unless medically necessary, unless baby is in true distress or something. But if baby can't stay with me, I want my husband to go with him and to not let baby be out of sight from him. All right, final section, you guys. Post-birth. A lot of these things are, like I said, the midwife told me they're hospital practice anyway, but it's good to have them in my birth plan nonetheless. We all know the importance of skin to skin right after birth. You know, there is critical bonding that happens immediately after birth when baby is on your belly, on your chest. It helps baby learn your smell. You learn baby's smell. There's all of those bonding hormones, all that oxytocin from that skin to skin, and those bonding hormones also kick your milk production into gear. So if you are planning on breastfeeding, that really helps to get you lactating. So there are so many important reasons to do skin to skin immediately after birth. So baby not to be taken from Amanda's chest for 1 hour post-delivery unless there is an emergent need. If there is an emergent need, then I want Bill to go with the baby. And obviously baby can breastfeed if he desires. Bathing, I'm also asking, do not bathe the baby for 24 hours and then only with consent. This is something else that they actually said they are now doing in this hospital anyway, is not bathing. They'll wipe the baby down, but they don't bathe the baby. You want them to have that vernix because it helps them transition from being in a water environment to an air environment, and having that vernix still on their skin helps their skin make that transition. And when you wash it off immediately, the baby can be a lot more prone to eczema and dry skin and that kind of thing. And the baby is also still benefiting then from those beneficial microbes for an extended period of time, which helps initiate their immune system. And then I have, do not discard the placenta because I'm going to do placenta encapsulation this time. Maybe I'll make a separate video about that at some point. I didn't do it with my first, and I did do it with my second, and it was like a night and day experience, especially with preventing postpartum depression and having energy after birth, like night and day experience. I'm so glad I did placenta encapsulation last time. I felt so energized. I didn't have hardly any sort of baby blues, postpartum depression, nothing. And I really am a believer in it now, even though I was grossed out about it the first time, which is why I didn't do it then. But now I'm like, man, this is how I'm going to do it from now on. So yes, I'm asking them to keep my placenta sanitary and to put it in a safe place in a refrigerator so that I can take it home. We'll bring a little cooler with us, and then I'll have the service that does that come to our house and pick it up and encapsulate it for me. And then the procedures that they do with baby, vitamin K, it's an injection that they usually give the baby. You know, if they have this tiny chance of having a bleeding disorder, it prevents them from bleeding to death, basically. Just want to make sure it's erythromycin, and also to do it after that initial 1 hour bonding period so that baby can see mama's face clearly. So that's my preference for eye ointment. And then the Hep B vaccine. I am opting to not do it in the hospital, but to do it with our primary care physician a week or two after birth. And that's how I've done it with the other two. I'm not going to go into my whole philosophy on vaccines in this video. If you are interested, I know it's a highly controversial subject, but I do have an opinion on it. I can go into that if you're interested down the line in me talking about that. But for the sake of my birth plan, I am asking to not do it in the hospital. I'll be doing it later with our primary care physician. And then the other controversial thing I have on there is circumcision. We are having a boy, and I'm also not going to go into detail about our reasoning behind that. I know some people are like, oh, I feel like I'm not going to talk about anything that has to do with my child's genitalia on YouTube, but I feel like this is something that we feel pretty strongly about, and I don't feel like it's that big of a deal. We are asking to not have our son circumcised. It is not considered medically necessary anymore anyway, and no, hardly any insurance covers it anymore anyway. No, they would ask us first, but I just want to have that in the birth plan. No circumcision, that's that. I can, if you want, discuss my reasoning behind that. I know that is also a highly controversial subject, and I don't judge anybody for their decisions on whichever route they go. but we do have our own reasons for not wanting to circumcise. So on that happy note, that is the end of my birth plan. I hope that gave you guys some insight. If you are working on a birth plan as well, maybe it gave you some ideas of things you might want to add into yours. And if you have already done a birth plan, what am I missing? Like, have you guys included anything in your birth plan that you felt was really necessary? I'm really curious what other people put in theirs as well. Anyway, I hope it was informative for you guys, and if it was, give it a thumbs up. If you guys are new here, as always, be sure to subscribe and hit the notification bell if you'd like to see more videos, especially since this little guy is going to be arriving soon. So thank you guys so much for watching, and we'll see you next time. Bye.